Here we are on site at Whitney Wells' home. She's a 6-year-old dysphagia sufferer. Dysphagia is a disorder that causes patients to have weak swallows so that they are not able to eat safely. I'm a speech therapy assistant and a student, and in my experience I've come across a problem in the world of speech and felt that I should reach out to other speech therapists such as yourselves for help. VITALSTIM therapy is an FDA-approved method for the treatment of dysphagia. It uses electrode stimulation for the treatment of dysphagia. It strengthens the muscles and helps the patient swallow safely. Annually, 60,000 patients who suffer from dysphagia die. They die annually because most often aspiration pneumonia caused by food or their own saliva going into their airway. A child that suffers from dysphagia cannot enjoy social activities surrounding food. They're not able to taste the sweetness of a birthday cake on their birthday. They're not able to enjoy lunch in the lunchroom at school with their friends. They're not able to experience the coolness of ice cream going down their throat, because these activities all could cause aspiration pneumonia, or as I previously stated, even death. So who provides this treatment for dysphagia? MP, who's the leader of electrostimulation therapy, states that the treatment of dysphagia in the USA primarily falls to speech therapists. VITALSTIM is the only neuromuscular electrostimulation device that is approved by the FDA. I'll show you that there are many studies showing that VITALSTIM therapy is more beneficial in the treatment of dysphagia than other standard methods. Many children suffering from dysphagia suffer unnecessarily because their insurance does not cover the simple method. MP notes that VITALSTIM therapy has not yet received approval by most insurance companies because of the perceived lack of evidence supporting safety and efficacy of the use of electrostimulation therapy. However, the evidence base has grown significantly over the past 2 years and now satisfies the criteria of evidence-based practice. MP continues to say available evidence supporting the use of VITALSTIM for dysphagia at present exceeds the evidence supporting other reimbursable interventions used in the treatment of dysphagia. Wake Forest University did a study. 57%, the blue area, shows that there was an improvement in their swallow. These are all pediatric patients. 17% achieved a normal swallow after the use of VITALSTIM therapy. FDA study by the Chattanooga group showed that 100% of these subjects demonstrated improvement in their swallow scores. 92.9% achieved at least a minimal swallow, and 50% achieved a normal swallow on the swallowing scale. 50%. Whitney, who's a 6-year-old dysphagia sufferer who was born with CHARGE syndrome, has been denied this therapy by her insurance. She's experienced an average of 6 hospitalizations a year, costing the insurance company at least $50,000 a year. That amount does not include all of the costs that she had incurred from the medications, antibiotics, breathing treatments, for treatment while she's at home. Whitney has been on antibiotics 50% of the time in her 6-year lifespan. This not only is not good for her, but it's also costing the insurance more money. There's a risk that antibiotics will not continue to fight the infection, and the antibiotics cause problems to her digestive system that causes her discomfort, and again costs the insurance company more money to treat the side effects of using the antibiotics. The antibiotics treats the symptoms, but does not treat the cause of dysphagia. Spalding University conducted a small study of parents of children with CHARGE syndrome and their attitudes of VITALSTIM. 7 parents of children with CHARGE syndrome were interviewed and asked, would they continue and recommend VITALSTIM therapy for the treatment of dysphagia after their child had used that therapy for the treatment, and all 7 recommended VITALSTIM therapy over the other treatments for dysphagia. We see from the study that VITALSTIM therapy has great odds in the treatment of dysphagia, more than other conventional methods. It can ultimately save the insurance company money, yet it's still not covered by insurance. We, as speech therapists, must pressure the insurance companies to cover this method in the treatment of dysphagia. Imagine this to be your child, in and out of the hospital, sick and always on medications unnecessarily because this simple therapy treatment is not covered. We could all prevent this. We must, as speech therapists, continue with the case studies showing the benefit of this therapy. We must submit our information to medical publications to get the information out there, and submit this information to insurance companies to help them understand that this is no longer considered an experimental method for treatment. Show them that it is FDA approved and that it is more beneficial than the methods that they are currently paying for. We have many studies showing the great benefit to the patients as well as insurance companies' pocketbooks. VITALSTIM therapy could save lives. The life it saves could be your own child. Thank you.